Welcome to my channel. Please like, comment, and subscribe. Costa Rica is one of the most popular destinations for expats across the world, and millions of foreigners start a new life in the country. Still, moving to a new country can be stressful enough without including the stress of health insurance. So if you decide to move to Costa Rica, it is vital for you as an expat to understand how the healthcare system works there. Expats working and living in Costa Rica must register with the country's national healthcare system, known as the Caja Costarricense de Seguridad Social, or simply CAJA. Registering with CAJA is obligatory for every expat who lives and works in Costa Rica long term. However, many expats in Costa Rica prefer to have private health insurance as well because it offers access to private clinics and hospitals, shorter waiting times, and English-speaking doctors. Expats in Costa Rica have two options when it comes to choosing private health insurance. They are government-supported insurance provider is a private insurance scheme supported by the Costa Rica government that offers supplemental health care services. And then international insurance provider. You can choose your insurance coverage as long as they offer international policies in Costa Rica. The CAJA is funded by the public, where each employed resident pays a monthly amount towards the healthcare schemes. The amount changes depending on income, but it usually ranges from 9% or 11% when expats enter the country and register with the CAJA. They receive public health insurance covering almost 90% of their medical needs, including pre-existing conditions. If an expat is working as a freelancer or is self-employed, then the amount they pay to the CAJA depends on how much they earn a year. The CAJA covers several services, including the three medical facilities which any expat can visit and require services while staying in Costa Rica. Number 1 is hospitals. Work 24/7 and offer emergency services, general health care, and specialist health care. Number 2, clinics. Open from 7 a.m. to 10 p.m. and offer similar services as the hospitals. Open from 7 a.m. to 4 p.m. Treats minor injuries like sprains or colds and provides general checkups. Registering with CAJA is obligatory for every long-term resident who possesses a valid resident card to Costa Rica. The registration process for the CAJA is as follows. Number 1. Get your documents ready. As soon as you enter Costa Rica, you have to sign up for the CAJA, and you need to submit several documents that include the following: your residence card or a document from the immigration authority proving you are eligible for residence in Costa Rica, and then your passport, and next is a notarized photocopy of your passport ID page containing your entry to Costa Rica, and then evidence of your address and residence like utility bills, and registration request form, and it is provided by your employer. Number 2, visit your local CAJA office. Once you get your documents ready, you have to visit your nearest CAJA office, submit your application, and pay for the registration. Bring your receipt with you since you will need it to retrieve your card. And number 3, retrieve your card. Once your application is processed, you have to take your receipt, go to the CAJA office, and retrieve an appointment card proving your right to healthcare services. This card will be stamped with the same validity date as your residency card, which means you have to reapply for this process if you receive a new residence permit. Because it takes a while to process your registration with the CAJA, you need to have valid health insurance during that time. For this reason, you can choose an international private insurance provider that will cover your stay in Costa Rica. Expats are eligible for free public healthcare services in Costa Rica. However, they pay monthly social contributions to the public health system, which in turn cover the cost of seeking medical attention. The only persons eligible for entirely free healthcare in Costa Rica are citizens in financial difficulty. Thank you very much for watching. Don't forget to always give your like, comment, and subscribe.